At this time when many people are having challenges because of sometimes childhood abuse, poverty, long-term ailments. There are many causes really of mental health, and the Ministry of Health has taken this to a higher level to ensure that we address these issues through creation of awareness to the communities. So I am happy with the Catholic Church for, especially the Kerugoya Catholic Church, for taking this a notch higher and engaging the community leaders together with the national administration so that they can see that families do not continue getting torn apart. The increased cases of gender-based violence. You saw the other day there's a lot of femicide in the country, and some of it is due to, it's not just normal crime, really. It is actually mental health illness. The rising numbers of suicide and murders, really, which has taken a toll on all of us. Mental health is not just a personal struggle, but it is a community struggle, and that is why I am happy that this community has come together to talk about it openly. Despite the many challenges that we have and the realities of life in the villages, the stigma continues in our communities. And to the response of this at the Ministry of Health, I am aware that in the Social Health Authority, we have injected this as part of the services that will be offered in our health facilities. So too often mental health illness is dismissed as a spiritual failure or a moral weakness, and it leaves those who are affected to suffer silently because nobody wants to talk about it. But let us be very clear that mental health is not weakness. It is a medical condition that must be attended to at any given time. And seeking help is not a shame. It is an act of courage. So anybody out there who could be having mental health illness should be able to come out and seek medical attention. Register with the Social Health Authority, and when you go to hospital, you will be treated. And a call to action is together we can heal, because probably we could be walking patients and we do not know what we are suffering from. It is important to seek help. The Ministry of Health recognizes this as a key public health priority, and we have put in place several interventions to ensure that the promotion, the prevention and support of the same is taken care of. Community health promoters who move from door to door. In our curriculum, I am aware that we have injected this as part of the assessment that needs to be done so that we are able to reach as many people as possible. The insurance, the cover, the injection of mental health into our insurance cover covers consultation, therapy sessions, medications, and even rehabilitation where necessary for managing the mental health conditions. So by leveraging on SHIF, we will reach a critical number of our population to ensure that people get healed, and get healed when things are not too bad, when we have not gotten to the point of going suicidal. Many ways you can discover a person who has mental health disorders. And we have mood disorders. We have what we call mood disorders. We equally have anxiety disorders. When you have seen people who become quite restless. You're sitting next to them, but they are just restless because probably there's something disturbing them. And there's the personality disorder. Sometimes somebody may just be around you, and probably if you don't even recognize them, it gets into their nerves really hard. So these are signs and these are areas to look up to, so that if we have people who have mental health disorders, it is important that we direct them to go to hospital, because mental illness is a medical condition.
And therefore, together with wengine wenye wako jiani that we are expecting to come, that has been occasioned by mental health. And then we say the best he can do is understand the challenges the mental health has brought for the family unit. Akiwa Nairobi amekuwa akisumbuliwa sana. Now and then kuna WhatsApp groups za mazishi. Na the event was about Kenya family. Na pia a lot of family breakages within North Kenya region. And we also came to understand that the labda just kupeana ningetaka kuomba Father James aweze kutukaribisha na pia kutuliza sura wako. We're just trying to understand the root causes of the challenges we are faced to start in conjunction with Reverend Father Dr. James, who is a lecturer at
mental health